surprise you. 8 out of 10 of us will experience back pain at some point in our lives. And doctors usually treat back pain patients first with painkillers, then maybe surgery. But there's a new book out called Healing Back Pain Naturally, the Mind-Body Program Proven to Work. And Dr. Art Brownstein is with us. He is the author. Nice to see you.
Nice to see you again.
How come so many of us get back pain? Is this an epidemic, or are we as a culture doing something desperately wrong?
Both. Right on both counts. Yes, we spend a lot of time sitting down, and when you sit, you know, with our sedentary lifestyle, we don't use the muscles in our back, which are the most important part of our backs. And then you add the element of stress, which compresses the spine through the nervous system being, you know, stimulated and the brain being excited. So it is a cultural phenomenon, and it is a huge epidemic. You look at the poor third world countries of the world where they don't have our lifestyle, you find very little back pain. So it can be corrected.
Yeah. Now, you have a personal story here. You had a desperate time with your back.
I had a 20-year history, including an operation that left me in worse shape. I couldn't work for 3 years as a physician. I was hooked on drugs for the pain, and I was depressed.
Powerful drugs.
Yes.
And then you had to kick them, and then that was terrible, too.
Yes, and I became depressed and even suicidal. And then I was offered a second operation, and that was my wake-up call, and I said no. And I actually left the country and ended up in the Far East, and particularly India, and I found such simple things that I'd not learned in medical school, and they healed my back pain naturally. And looking back on it, I felt, you know, why didn't anybody teach me that?
Well, what does not conventional medicine understand about the back?
It doesn't understand that the muscles are the most important part of the back.
Not the joints themselves, not the vertebrae, not the cartilage.
No, the muscles govern the health of the joints, the cartilage, and the vertebrae. And the muscles are where the pain is coming from. The pain receptors in the back are located in the muscles, not the bones or the discs. You know, when you go to the doctor for back pain, the first thing you do is take an x-ray, which shows the bones. Muscles don't show up. So we've already bypassed the most important system in the back. And those muscles are connected to your brain through the nervous system. So mental stress, worrying about your bills and paying your rent and what's going on in the government, these things come directly into your back, and we know this because back injuries happen during times of stress.
Well, let's show the folks at home a graphic from your book. Speaking of stress,
yes.
You suggest that stress goes directly from the brain and right into your back.
Exactly, and you can see the connection here through the brain, connected to the back muscles, through the nervous system. It's very clear. And the second thing happens in the second illustration, where the back muscles themselves become compressed, and that chokes off the blood supply. So we want to lengthen those muscles, we want to stretch them, and we want to calm down our nervous systems. Without drugs or alcohol, that will allow those muscles to lengthen, restore the blood supply, and healing occurs.
So how do we do this? What do we do? We have to learn to relax?
Yes, we do. And it's easy. Probably the simplest thing is just focusing on your breathing, which is something we take for granted. The breath is the link between your mind and body. When you are under stress or when you're agitated, your breathing is shallow and rapid. And that causes the nervous system to be hyperstimulated. So you want to slow down your breathing. You can do it with me right now. Just take a nice, slow, deep breath. And you can feel your chest and ribs expand, and because every rib is connected to a vertebrae, you're actually moving the bones of your spine just through your breathing. And you're calming down your nervous system. That allows the muscles to lengthen, decompresses the spine, and healing occurs.
Boy, and we are just scratching the surface. So you talk about diet, you talk about exercise, you talk about stretching.
Yes, it is a holistic approach. It is not a mechanical problem. The surgery just is the quick fix. It doesn't address the underlying causes.
Well, we're out of time. Nice to see you.
Nice to see you.
Here's the book, How to Fix Your Back. We'll be right back.